Ever stay up late, staring at a screen,
Mm-hmm.
and then, like, look up and suddenly everything's doubled? I
Yeah.
swear it happened to me back in college. Scared me half to death.
Oh, wow.
Turned out to be just eye strain, but still. Makes you think, right? We usually brush double vision off as a joke, but it can be serious.
Yeah, no, for sure. Not always a laughing matter. We're talking about diplopia, which is the medical term for double vision.
Right.
And it's not just seeing two of everything either.
Here.
Could be horizontal, could be vertical, even diagonal sometimes.
Oh.
And get this, the root cause sometimes isn't even the eye itself.
Okay, now that's wild. So we're diving into double vision today, trying to understand what causes it, when to worry. We've got some research.
Yeah.
Looks like two main types, monocular and binocular diplopia.
Right.
I'm no eye doctor, so break those down
Yeah.
for us.
Okay, sure. So monocular diplopia, that's the less common one. It's when you see double in one eye, even with the other one closed.
Really?
Yeah, so think of it like this. Your eye's lens, it's kind of like a camera lens, right?
Right.
If that lens is messed up, like misshapen or something,
Yeah.
no matter how hard you try to focus, the image is going to be blurry, distorted, and that can make you see double.
So it's not about the eyes being misaligned. It's more like the eye itself is dot off.
Exactly. And it gets even more interesting. The stuff you shared, it mentioned some weird causes for this. Cataracts, astigmatism, even dry eyes.
Wait, seriously? Dry eyes can cause double vision.
Yeah, it can. It's all about how light's being bent, focused inside the eye. Now, binocular diplopia, that's the one most people think of. Both eyes are open, but they're not working together. Like, imagine using binoculars that are totally out of whack.
Oh, man, yeah. Recipe for a headache, probably.
Right.
So that's mostly like crossed eyes and things.
Crossed eyes are common, yeah. But the research, it really highlights that this binocular kind,
Yeah.
it can be a symptom of bigger problems. Diabetes, Graves' disease, even brain tumors in some cases.
Wow. Okay. So definitely don't want to ignore that. And this is where I imagine it gets tricky. The research lists tons of causes, some no big deal, others, like you said, super serious. So how do you know if you need to call the doctor?
It's a good question. Knowing when to get help is key. Here's the thing. If you suddenly get double vision, especially after an injury, go straight to the doctor.
Don't mess around.
No messing around. Other red flags. Pain when you move your eyes, drooping eyelids, headaches that won't quit, feeling nauseous, or if your eye muscles feel weak.
Sounds like even if it's minor or comes and goes, better safe than sorry, right?
Exactly.
And speaking of being cautious, the research mentioned temporary double vision after LASIK.
Right.
What's the deal with that?
Yeah, so some double vision after LASIK is normal, part of the healing. But your doctor should always monitor it. Don't just ignore it thinking it'll go away on its own.
Right.
There might be extra steps to make sure everything heals right. You know, your vision is good as new.
So let's say someone's diagnosed with double vision. What are the treatment options? New glasses, or is it more complicated?
Just like most medical things, it really depends on what's causing the problem. But the good news is we've got a lot of different ways to treat double vision.
Okay, walk us through it. What does the research mention?
Well, sometimes it's as easy as corrective lenses.
Okay.
The research, it actually uses this cool analogy about prisms.
Okay.
So you know how a prism splits light into a rainbow?
Yeah, classic science fair.
Exactly. We can actually put special prisms right into eyeglass lenses.
Really?
Yeah. And those prisms, they help realign the images coming from each eye so your brain can merge them into one clear image.
Huh. So you're kind of tricking the brain into seeing properly.
That's a good way to put it.
What about when it's more complicated than that?
Right. So for more complex cases, vision therapy can help.
Vision therapy.
Yeah, it's kind of like physical therapy, but for your eyes.
Oh, okay, so eye exercises to strengthen the muscles.
Exactly. Think of it like having a weak arm. You do exercises, build strength, improve coordination. Vision therapy is similar. You're training your eyes to work better together instead of lifting weights.
Makes sense.
So that might be eye tracking exercises, focusing exercises, or even special lenses during activities
Yeah.
to really challenge and improve that coordination.
So take some work, like sticking to a PT regimen. Okay, what if it's beyond weak muscles, though? Like a problem with the eye itself?
Well, in those cases, surgery might be necessary. We talked about cataracts. They can cause double vision. Cataract surgery is super common, very effective. It fixes the problem with the lens of your eye, which often gets rid of the double vision, too. And then, of course, there are surgeries for other things that can affect your eye alignment, like issues with the muscles that control how your eyes move.
I bet that's more intense than, like, Elie Vesic.
Yeah, you're not wrong. But get this. This always makes me laugh. One of the treatments mentioned is Botox.
Wait, Botox, like the wrinkle stuff.
Yeah, the same. You see, Botox can actually relax muscles, which is super helpful for certain kinds of double vision.
Hmm.
Sometimes the muscles that move your eyes, they're getting mixed signals from the brain, so your eyes are misaligned. Botox can block those weird signals and your eyes relax into a better position.
Wow, you really do learn something new every day. So we've got all these treatments. What's the outlook for someone with double vision? Is it forever, or can they recover?
Good news is most double vision cases can be completely fixed with the right treatment.
That's good to hear.
But of course, the long term depends on the cause. And some people might need like ongoing management, especially if it's tied to something chronic like diabetes.
So early detection, early treatment, that's key.
Absolutely. The sooner you figure out the root cause and address it, the better your chances of a good outcome. We've covered a lot: what double vision is, why it happens, how it's diagnosed, even treatments. But we haven't talked about prevention.
Right, better to prevent than to cure, as they say.
Right.
So how can people keep their vision in tip-top shape? Two eyes, seeing one clear image.
It's all about being proactive, healthy habits, like managing diabetes well.
Okay.
If your diabetes isn't controlled well, it can damage blood vessels, and that includes the tiny ones in your eyes. That can cause something called diabetic retinopathy, basically damage to the back of your eye, which can blur your vision, even cause double vision.
So managing your blood sugar
Mm-hmm.
through diet, exercise, medication,
Yeah,
that can really help avoid those problems.
exactly. And speaking of staying on top of things, don't forget regular eye checkups.
So important. Catch those problems early.
Yeah.
What else can people do to protect their vision?
Yeah, those are important. But this whole thing has got me thinking. We're talking about prevention, right? But we're constantly on screens these days.
Right.
Is it possible everyone's at higher risk of eye problems in the future, even if we're careful?
That's the question, isn't it? It's like we're all part of this big experiment with how much time we spend staring at screens.
Right. It's hard to say what the long-term effects will be. It's too early.
Yeah,
But it's definitely something to think about.
for sure.
Good news is more and more people are aware of it. We're learning more about how to minimize the risks.
So what about those blue light glasses? Do those actually work, or is it all hype?
You know, the research is still kind of mixed on that one. Some studies suggest they might help with eye strain and even sleep.
Okay,
But we need more data to say for sure.
right.
But listen, blue light glasses or not, there's a lot you can do to protect your eyes. Take breaks from your screens, adjust the brightness, make sure you're at a comfortable distance. That makes a big difference.
So like with most things,
Yeah.
moderation, right?
Exactly. And that's where all those prevention tips come in. They're not just about double vision, they're about keeping your eyes healthy for years to come.
Yeah. Eyesight is definitely something you don't want to take for granted. So as we wrap up this deep dive on double vision,
Mm-hmm.
what's the main thing you want our listener to remember?
I think the most important thing is double vision, yeah, it's scary. But it's usually a symptom, not a disease in itself.
Right.
And if you understand the different types, causes, warning signs, you can make smart choices about your eye health. Get help when you need it.
Absolutely. Knowledge is power, like they say. The more you know, the better you can take care of yourself. Well, everyone, we hope this deep dive has given you a clearer picture of double vision, pun intended. And on that note, I think it's time for this host to give his eyes a little break from the screen.